Start the session. Fab. Thank you very much. Okay, so for those of you who haven't been to one of these before, this is our strength-based learning program. So we ran one of these last year. This is something that came through an organisation called Mayday, who we merged with last year. Something that they started and something that we have continued and we've seen go from strength to strength. So it's really lovely to see you all here. We had a record number of signups this month. The topic of today is working with our communities in a strength-based way. So I'm really fortunate to be joined by Sinea and Rodri, who are both part of one of our community projects in Riska, and are going to talk to you all about the work they do, drawing on community psychology. So it's going to be a great session today. It's a fabulous project. They're a fabulous team. So they will no doubt have lots of really interesting things to share with you today. The session, there'll be an hour-ish of presentation. We'll then take a short break. We'll stop the recording and then we'll have up to 11:30 for questions, reflections, just space for people to ask anything they want to ask that's come through the course of the session, or anything related to strength-based working that's sort of been nagging at you and you maybe want to ask a community of people for some advice or thoughts. So that's how we will work. I am Sham. So for any of you who's not met me before, I'm part of the Platform Wellbeing team. I'll talk to you a little bit about the various things that Platform do in a second. In fact, I will do that. I'll do that right now. So Platform has been around for 35 years now. We work with 300 plus staff. We support over 15,000 people each year across 150 projects and services. So we've grown a lot from when we started 35 years ago, predominantly in South Wales. So we work across 5 Welsh health boards, 15 local authorities, but we're also kind of branching out over the border slightly as well from a kind of training and obviously this network. So Platform has kind of 4 key areas, I guess. We have crisis prevention and home. So we started off in housing. That's kind of our bread and butter. It's where we started. We still have crisis services, supported accommodation, specialist housing support, and homelessness prevention services. Alongside that, we have employment, volunteering, and skills development teams. So work placements, peer mentoring, community support. So lots of really good stuff in the communities going on. We also have a children, young persons and families team, which grows all the time. I'm sure every other week there's a new person joining that team. It's just going from strength to strength. But it's all about offering wellbeing programs, one-to-one and group support, community-based services, out of hours drop-in. It's a fantastic team doing some really fantastic work. We have Platform Wellbeing. So this is my team where I sit. And we do all things training and counselling. So we have a fantastic talking therapies team that offer counselling services and clinical supervision. And then we have a training team that does kind of consultancy and training. I will talk to you a little bit more about that at the end. And then finally, we have our campaigns and influencing team. So we do a lot of campaigning and working on policy with Welsh Gov alongside the community work that we do. And the reason for that is because of Platform's missions, really. So we have 2 key things that we want to be able to do. We want to change the dominant narrative around mental health. So really advocating for the role that trauma, experiences, socioeconomic circumstances, social injustice, all of those things have on our mental health and our ability to heal. and make that evidence and that knowledge accessible to everyone. So that's partly done through our community services, it's partly done through our policy and influencing team, it's partly done through platform wellbeing. We're all really part of sharing that message. And the other things we want to do is make helping systems work better for people. So that's one of the reasons we host this network. We want to change the way that we can provide services to people in distress, and really prioritize the focus on kind of housing, homelessness, young person systems, mental health systems that we interact with. That's Platform in a nutshell. Again, if anyone has any questions about Platform, feel free to put them in the chat. I'll keep an eye, and I will come back at the end of the session today to talk a little bit more about some of the work that we do. But for now, that's it from me, and I'm going to pass over to Sineya and Rodri to take the rest of the session. Over to you.
Thank you, Sian. So, hi everyone. My name's Rodri. I think my title is Senior Assistant Psychologist slash Community Lead on the project that we're running. Um, Full disclosure, I'm slightly under the weather, so if I do mute mid-sentence and go off screen, I am just coughing off the side of the couch momentarily, but ignore that for the time being. So, what we'll do is essentially we're going to split this sort of into two. So first you'll get me and then there'll be Sineya. So I'm going to talk a little bit about some of the theory that underpins what we do. And then or Sineya will go into how we use that and how that's applied sort of on the ground. Um, So Sinead will probably definitely be the favorite. She gets to talk about sort of the nice, fun stuff. I will say that everything that we cover, I'm by no means an expert on every aspect of it. Sort of each element is something that could be a session all by itself. But hopefully, what we can do is either just develop some basic understanding for anyone who may not have experienced some of the applications of the models we're talking about, or just for anyone who hasn't heard of any of them before. So, just to begin with, everything that I'm going to be talking about can be described as falling under the umbrella of community psychology. So I'm not sure, obviously, there's a lot of you here today. I don't know what people's knowledge is of community psychology, but obviously, psychology in of itself as a discipline is really broad, but I tend to find that when people talk about psychology, what they generally are talking about is clinical psychology. So it might be helpful just to start with to add some context around what community psychology actually is. So when I talk about community psychology and compare it to clinical psychology, I'm not advocating for one or the other. There's definitely scope for both. Before this role, I was working in the NHS, so I have experience of both. So it's not a case of for and against, it's just differentiating. So no fighting in the chat, please. So as you can see, while the two are also very broad, generally what clinical psychology is focused on is an individual person's mental health and well-being. They could be assessed or diagnosed or treated for difficulties within a clinical setting. So more often than not, that could be hospitals or wards or mental health teams. And the general idea is to focus on things like individual pathology before formulating and applying a direct resolution like a therapy. So, in contrast, community psychology looks at a community as a whole. It considers what the impact of the community has on individuals. And rather than treating a condition and then discharging someone once that's finished, community psychology tries to understand the social factors at play. So, what in someone's environment, what in the community is impacting mental health and promoting social change, which could bring this about. What I tend to do in these is ask at the end of sort of every slide is, does that make sense? If you notice me saying that a lot, just ignore me, just nod. Or if there's anything in the chat, I don't, is anyone monitoring the chat, Sean? Yeah. Well, do we tend to wait until the end, or can people jump in? What's the normal?
However you want to do it. If you're happy for
Okay.
people to jump in,
Yeah.
I'm happy to interrupt with questions as and when they come through.
Okay, great. So if anyone wants to jump in or I can explain anything more, please do. But otherwise, I will crack on. So if we go to the next slide, please, Sean. So, so these are just some of the key pillars of community psychology. And over the next few slides, I'll go into a bit of depth with them. You'll notice when I go over some of the factors that there can be quite a lot of overlap. So there'll be some factors within each that you'll see in different pillars themselves. They can feed in and out of each other to varying degrees. So because of that, I won't cover each of these individually, but just by going over a few, we'll definitely touch on all of them just by covering them. Um, you might notice as well that the language might be different on different slides or different to what you see on this diagram. But just like any other discipline, community psychology is always evolving. So some of the language might adapt or is updated with time. But we'll note that in future slides. Essentially, this was the diagram I chose because I couldn't find a better one that included some of the pillars. Um, so we'll make do. We'll start off with the collaboration and community strengths. So next slide, please, Sean. So collaboration and community strengths are at the heart really of any strengths-based practice. When we talk about collective action, what we're really talking about is how people come together, how they combine skills and how they share burden, celebrate wins as a group. It's not just about helping people survive, it's about building their capacity to thrive. We know that a focus on social justice as well means addressing inequalities and ensuring everyone's got access to opportunity. We know that's something that can happen from the top down. If it could, it would have already happened. It requires community participation and shared decision making. So when people have real ownership over that process, change is more meaningful and we know that it lasts for longer. As professionals, our role is to co-create with those communities to help them see and utilize the strengths that they've already got. It's about stepping away from the doing for and moving towards doing with. Um, the one thing I'll touch on the notes here is the multi-level perspective, because I think a lot of the other points here when we're looking at things like social justice and participation, some of it can be a bit self-explanatory, whereas from the outside, multi-level perspective can be quite vague. So, multi-level perspective recognizes that individual behavior and well-being are influenced by various interconnected systems, and that can vary from individual factors to massive societal and cultural contexts. So when we think about interventions from a multi-level perspective, we may consider addressing the root cause, enhancing effectiveness, or things like promoting systemic change. So, for example, if we take something like community violence as an example, the idea of resolving that wouldn't just be keeping two people apart or keeping conflict separate. It would be, and then sort of considering that would be problem solved, it would be resolving various individual conflicts within themselves, but also things like coaching conflict resolution within the community. It would be things like violence prevention initiatives. So that would include stuff like graded exposure among subgroups and system change, communication with police about weapons or increased security. Obviously, for something like that to work, you need buy-in from people at different levels. So the residents themselves, us as professionals, stakeholders, policymakers, and as well, you would need to be aware of things like cultural differences and consider sustainability. What I mean by that is if you're thinking of a multicultural community, if you're telling one or multiple, for example, religious groups to ignore their practices for uh, the benefit of wider community for whatever reason that may be, or if you're paying someone, an outside agency, to come in to do 3 or 4 sessions but have no real plan of any follow-up on that, that's not necessarily sustainable. So across multi-level perspectives, there needs to be that emphasis on that sustainability and an awareness of cultural differences. Excuse me for a second.
Just while you're coughing, we do have a question. So Heather's asked, does platform utilize nudging, and if so, how?
Nudging.
Nudging.
I'll be
Would you
honest,
like
I've
some
not heard.
clarification on that one?
Yeah.
Heather, do you want to explain a little bit more about what you mean? If you are happy to jump on audio, please do so. And if not, write it in the chat and I can bring this question up again a bit later.
Okay, hello. Yeah, it's a concept with me being in my final year of psychology, nudging is something that I have studied for decades without actually knowing what it was called. It's basically how it's either used in self or it's a way of trying to change social structures in a way that's more beneficial for the individuals. It can be used negatively, but it can also be like when someone it's like with the smoking ads, it's like with a lot of these health things. What they do is they encourage people to make healthier choices in ways of without actually really being obvious. Take a look at your grocery stores. The healthier stuff is put in the front, the bad stuff is put in the back. It's a way of encouraging healthier options in a way of strategic influencing,
Okay,
if
yeah, I
that
think
makes
that makes
sense.
sense. Yeah. So I think we'll cover a lot of it in some of the theories later on and sort of the frameworks that we use. But I think from the sounds of it, and correct me if I'm wrong, by the sounds of it, nudging is almost sort of pointing or steering people towards a certain direction. And I think what we try to utilize a lot is the idea of co-production, so being community led. So while we might consider the idea that something like you mentioned, healthy diets might be more beneficial for people, from our perspective, because we want to be co-productive and be led by that community, if it's something that the community doesn't see that as a priority, that wouldn't be a priority for us to push. So everything that we do is, or we try to be at least community driven and co-productive. So I suppose no, not really. In terms of um our, and we will touch on this a lot more later, so I'm not going to talk about it extensively now, but when we set our goals and targets, the when we formulate them, it's entirely based on the feedback that we've been given from residents or people within our project. So unless that is something that has come from them, we're essentially just in place to be able to scaffold the ideas that have come up organically through residents and through the community. So unless that's something that has been noted to us, we wouldn't necessarily um almost plot that. We wouldn't say to someone, oh, we wouldn't take what we've noticed ourselves and put that onto someone. Does that make sense? Or does that explain it at all well? I hope it's not a no. If that's not clear, if you want to ask anything more, please feel free. If you didn't want to speak on the mic, please feel free to um put it in the chat. And I think I'm right in saying we are having a bit more of a conversation after the presentation as well, Sean. So
Yeah,
we could.
absolutely. And we've got a yes, thank you very much in the chat. So absolutely made sense. Really good answer. Thank you very much, Rodri.
If we go to the next slide, please, Sean. So in the original diagram, this was I can't remember what it was labeled as. I think it was empowerment. But when we talk about power sharing, we consider power sharing a better term than empowerment. And the idea behind that is that we are not in ourselves almost superior beings who can hand over power to other people. We share power with people in the community. If we see ourselves as people who hold all the power, we almost reinforce the hierarchies that are currently in place and that have harmed communities over time. If we're aiming for true collaboration, then that requires interdependence and a mutual reliance that recognizes that everyone has something valuable to contribute. We also need to acknowledge that communities are dynamic and that adaptation is key. So resources cycle in and out, leaders come and go, communities aren't fixed, they evolve. So a strength-based approach embraces that fluidity in succession. It prepares for others to take the lead and make sure that the work continues beyond our involvement within the project. And when we talk about building capacities, it touches what I've mentioned already. We're not starting fresh with something that's not there. It's strengthening a community's ability to identify and address its own needs and challenges. Things like fostering skills, resources, and relationships to create that positive environment for community members. We're working alongside the community and harnessing what's already available to them. We're not giving them something from the outside. We're just acting alongside them to harness what's already there. And again, within this, we can see a focus on social justice. And the reason you'll see it's prevalent across a lot of the different factors that we see in community psychology is that social justice in itself aims to promote well-being and address social problems by understanding that relationship between individuals and their social environment. So that includes actively working to reduce social inequalities and share power with marginalized groups. It pushes for systemic change. So when people see social justice within different organizations, sometimes that can come across as just a bit of a buzzword, sort of to try to make organizations look more progressive. But in terms of the underpinning theory of social justice, in a project like ours, and I'm aware we haven't gone into too much detail of the project, but we will in a short time. But there's no justice in the concept of people living in poverty, either from birth immediately or as a direct result from their experiences and trauma. For communities to be balanced and to be healthy, there needs to be social justice. So it underpins a lot of the models that you'll see within community psychology. And we'll touch on that again a lot more later on in the slides. Go to the next slide, please, Sean. So when we think about ecological perspectives, what that does is help us look at the bigger picture, which is obviously something that's massive in community psychology. It encourages us to look beyond just the individual and sees the systems that they're a part of. And when I mean the systems, I don't necessarily mean just services. I mean things like the families, the neighborhoods, schools, workplaces, broader cultural or political context that people find themselves in. You could argue really that given the first slide, that this is the most obvious aspect of what we'll touch on really, because it highlights that we don't just look at the individual, but those wider contexts. Uh, the image you see as well, it just shows the how broad that could be. So it doesn't just look at an individual person in his immediate environment. It includes that, but it doesn't just focus on that immediate environment. It also looks at their macro system, their social and cultural values, things like the societal norms that they find themselves in because of the environment that they're in. Um, where it also shows that we know that strengths don't exist in a vacuum. A person's ability to succeed depends on a lot of interacting factors. So a lot of within my roles within the NHS, a lot of emphasis is given on things like resilience. But someone may have immense resilience, but if they live in a community with underfunded schools or a lack of transport or chronic unemployment. We wouldn't just judge a person's well-being by a level of resilience. It would be based on everything else that surrounds that. Um, the point there about interdependence and adaptation, that refers to a person's relationship with that environment. So it acknowledges that a person's environment and a person themselves, they shape each other and they influence each other. And I know succession is something that Sinead will talk about later a little bit, but the idea with succession is that communities evolve over time. They're not fixed, their populations change, and as a result, so do their needs. And that goes into the thinking of when we're trying to apply these theories in the community. And that's why strengths-based practice has to operate across different systems. We can't just focus on fixing individuals. We need to advocate for system-wide change. And to do that, we have to understand the ecosystem around each person and community. And that's essentially what we mean when we say the ecological perspectives. Is that okay with everyone? I can't see anyone, so I'm basing everything on just nothing. I'm going on vibes.
We're all good, Rodri. All good.
Good. Okay. If we can go, thank you, Sean, on it already. Is that a hand I can see? No? Okay. So everything up until now has just been a very quick look at different aspects of community psychology as a whole. But now I'll briefly just cover some of the models that we've utilized within this project and continue to use that falls under the community psychology umbrella. These are the four that we'll cover. So we're going to look at place-based approach, trauma-informed practice, human learning systems or HLS, and asset-based community development or ABCD. Again, obviously, these four could easily just be sessions alone. So we are almost on a whistle tour stop of all of them. But again, we can discuss this further after the slides if anyone wants to do that. We'll start with place-based approach. So compared to the other theories, place-based approach might be, sorry, next slide, Sean. Thank you. I wouldn't say straightforward concept, but maybe just the easiest concept to explain to people. It's essentially what it says on the tin. The focus is on understanding and addressing social issues within a specific geographic location. It recognizes that people's lives are intertwined with their physical environment and social context. It's community led, so it relies on things like community engagement to identify those problems and develop solutions. Place-based work recognizes that context matters. You can't apply a one-size-fits-all model to every community. It recognizes that each community is unique with its own dynamics and its own customs. So, for example, just within our project, if we noted everything that Sinea and I had done on the ground, minute by minute, through the entirety of the project, then handed that over to other community groups, it would be wrong to just assume that if everything worked in the way that we were happy with, that that would be the case in other communities. Obviously, application needs to be different based on the community that you're working with. Each community is different. Um, and an important point, and again, I think Sinead will probably talk a little bit about this later, is long-term commitment. Obviously, communities are complex. The connections between individuals, systems, stakeholders, physical environments, historical factors, cultural identities, everything else you could go on. If you recognize that communities, regardless of where or what they are, that they're complex, you also have to recognize that any approach isn't just a straightforward A to B. Getting the necessary engagement and outcomes isn't a quick or linear process. It takes a long time to get that, and it takes a level of commitment. Oh, next slide, please, Sean. Okay, so trauma from practice just acknowledges the idea that um, or acknowledges the impact of trauma and guides your approach based on that. Obviously, trauma and the effect it can have on individuals and communities is again just a session all on its own. So I won't go too much into trauma and its impact because obviously we're pressed for time. But the idea is to create safe environments for people. So making safe physical and emotional environments for people who've experienced trauma, integrating that knowledge of trauma into your work. And that could be things like recognizing ways that trauma can manifest itself in people's behavior, implementing practices that are sensitive to the impact of trauma, and doing your best to avoid any possible re-trauma traumatization. The phrase you'll keep seeing when you learn about trauma from practice, or that I noticed anyway, is trying to shift that mindset from what's wrong with you to what happened to you. And I think it's something, if you've been on a few of these sessions, I imagine they've probably come up previously with, I know it's a phrase that's big within Platform and any of the training that we do. It's also just recognizing that trauma itself isn't just an event, but an ongoing process. And when we think of that in terms of communities, we know that ongoing trauma in deprived areas is a serious issue. People are exposed to repeated and prolonged trauma in a number of forms, and that's often compounded by socioeconomic disadvantages. And that in itself can lead to cycles of poverty and poor health outcomes, and not just for individuals, but across communities and across multiple generations as well. Next slide, please, John. So HLS is human learning systems, and what HLS is a um, essentially just a relational and learning focused approach. This looks like the most complicated thing so far, but we'll try to cover it in the easiest way possible. You don't need to pay too much attention to the diagram. It's a almost an alternative to almost the norm. So the traditional top-down target-driven models. Oh, sorry, 1 second. I'm getting a notification that my laptop's going to update, and I'm making sure I'm pushing the right one so it doesn't just switch off. Panic. So HLS focuses on complexity and human-centered approaches. So the idea that people are at the core of change, not services or systems. So when I think of my experiences of working in the NHS, the systems in place are really rigid. And again, this it's not a criticism. There are reasons for that. There's pressure from governments to do things like reduce waiting lists and get more people seen in GP clinics. But I think as a result of that, the pressure seems to be on those are the things that get measured. So people are looking at how many people have been seen within a certain time frame rather than what's actually happening in those sessions. Or um, I know that discharges, when people are discharged, that's seen as a success because in the short term it's reducing a waiting list rather than there being a focus on if someone's discharged because they haven't been able to attend sessions, there's no focus on why they haven't been able to attend, what's stopping them from being able to attend that. So in the context of community psychology, whatever gets measured in a HLS framework would be designed to support learning, support relationships, and adaptation. The goal is to understand what actually matters to people and what is the most beneficial thing to be measured, not just what's easiest to count. There's also an emphasis on it not being a fixed design. So I mentioned just now about systems being rigid. The idea with HLS is that it's co-designed by the people it serves, but it's never really finished. It's explored as it's implemented. So when issues arise, we all learn from that, we can reflect from that and go about redesigning before embedding again. So the cycle's continuous with ongoing adaptation throughout. I hope that makes sense. And next slide, please, Sean. So I've gone for two images in this one because I couldn't pick my favorite. But the last model we look at before we talk about the juicier stuff is asset-based community development, or ABCD, which is essentially an approach that focuses on identifying and building upon the strengths that already exist within communities. So the skills and assets within communities, rather than focusing on the problems and deficits that are there. The idea is that every person within a community has assets and has something to contribute. And there are also assets with a community generally, like associations, physical assets, economic assets, cultural assets. And ABCD looks at things like those assets as strengths. It uses a what's strong, not wrong mindset. There's an emphasis on building the solutions from within the community, not outside services or organizations to come in and fix everything. There's a real emphasis as well within ABCD to build relationships and connections. So if we think about wider needs of a community, the idea is that the resolutions to the issues that people face also lie within those communities itself. But without those connections and without those relationships, those assets sit dormant, either in an individual or within an organization. So that might be due to a person or an organization not knowing of immediate issues that are outside of their scope. So without those connections or without those relationships, they wouldn't necessarily get the opportunity to learn or know of that information, or get the opportunity to share the assets that are available to them to support others in the wider community. So there's that interdependence between a community. But if that interdependence is there because of those relationships, that serves the wider community. And if it serves it well, then that eases the reliance on outside agencies and services, and that makes the communities more sustainable, almost self-run from everything that's already available to them. Again, a lot of what I've just covered is very much a whistle-stop tour. Hopefully, I haven't gone through it too quickly. But what we'll do now is just cover everything that I've mentioned in terms of the theories and give a bit of background on the community we work in. And then Sinead will talk about how we've applied the stuff that I've spoken about in that community. So just some context in the area we work. This slide gives a small insight into some of the long-standing issues. So we work on a specific block or blocks of flats on a long road in an already deprived area. So the diagrams on screen now, that gives a breakdown of the full road, which stretches for a couple of miles. But the blocks themselves in isolation, based on the information that we have from residents, is significantly worse. So you can see that while there's a large amount of people who've never worked, the vast majority of people have worked in the past, but have been unemployed for at least a year. People who have worked in the last year are the minority, and there are a small number who have just never worked. And if we look at households by deprivation, only 41 out of 160 counted themselves as not deprived. And I imagine, to be honest, that none of them would fall under the flats that we work on. The other 119 counted at least one dimension of deprivation. And when we look at health data over time as well, things seem to be getting worse. So everything you want in red is green, and vice versa. Again, this is the data for the whole road. And we know that things are worse for residents of the flats, but even as in the area as a whole, health seems to be deteriorating over time and at a worse rate than the UK average. Next slide, please, Sean. So finally, for me, just some background from the community itself. So historically, the area is a working class community, and decades ago was booming from the heavy industry that was prevalent across South Wales. But as is the case with so many other communities in South Wales, pit closures started decline in a lot of their fortunes. So the local mine here closed in 1967, and that led to 1,500 job losses. Then a few decades later, in the early 2000s, a nearby steelwork also closed the majority of their production. That resulted in 1,300 job losses. So you've got a scenario where an entire community had faced huge losses across multiple generations, and the people most affected by the closures were then immediately hit further over the next decade by austerity measures. So the very little support that had already begun to shrink was essentially just taken away. And because the wider geographical area itself isn't seen as deprived, skewed data means that the government wouldn't necessarily identify where we work as an area of need. Individual services would, and individual people within services would. But the hard data and essentially where governments decide where money goes on organizational levels wouldn't necessarily pick this area up. Um, Over time, because of that, the area became more and more deprived. There was a local narrative started that the area was rough or violent, and the vast majority, forgot to mention, sorry, the vast majority of the flats in the blocks we work are council accommodation. But as a result of the reputation that started to build in the area, people were unwilling to accept tenancies here. So people placed in the flats were often offered accommodation as a last resort. So people on the housing waiting lists were essentially told, if you don't accept it here, you're off the waiting list. Um, this shifted demographics essentially in the area and quite quickly. So most of the people being placed here were single men. They were from out of the area, no real knowledge of the local community, no support network around them. A lot of the people here had either recently been released from prison or acute mental health wards. A lot of the people placed here had a long history of substance abuse. So the issues that we hear were almost manufactured by decisions that were made. And if you can imagine, if people are leaving places like acute wards and then they're placed back into an environment where no one really knows each other and everyone around them is heightened, the chances of sustained positive well-being are going to be limited. Anyone who's trying to, we know there's a lot of people within the blocks were with drug services, so they're seeing them for a short time, but then they're being placed back in a environment where there's quite a lot of drug use, and the you see drug dealers quite often. That's just a little bit of the context about where we work and where almost our starting point was. So what I'll do now is pass over to Sinea, who'll talk a little bit more about how we've applied everything that we've spoken about into and what we're trying to achieve as not just us, obviously, as a community.
Oh, thanks, Rodri. I'm Sneha. I am the assistant psychologist on the project, and I'll be doing the juicier bits that Rodri was talking about. Shan, could you go to the next slide, please? Thank you. So these are some of the quotes that we've got from the residents in regards to what Rodri's just shared in relation to their history. So one resident said, I liked where I was staying before, then I went to jail. When I came back out, they said if I don't take this house, I'd be homeless. Another resident said, it was either going to be these flats or I'd be homeless. They said I could go Rumney, but I won't have the kids. And another resident we spoke to said, before I moved in here, the word name of flats petrified me. And then we asked them, has this changed since you moved 8 years ago? They said, oh, yes, things still happen, but it's not as bad as it sounds. So this just shows how, like Rodriguez mentioned, the residents living here, they haven't even had the agency to choose where they live. And they're put in situations where they're not living with, say, their support system, families, or friends, and they're brought from other systems. And a lot of them are coming from forensic histories or with trauma backgrounds. Shang, could you go to the next slide, please? Thank you. Then we heard from the community about what maintains these challenges. We heard about how they had limited access to services and provisions. So when I first started working there, I noticed that there's actually a lot going on in the wider area, but for some reason, residents didn't have links to this. And from hearing from them, we realized that that's because a lot of the residents that we support have mobility issues. So they find it much harder to get to the main town where all these services are present in. Or also, these are the same people who, like Rodri said, are unemployed or can't afford to use public transport and they just can't afford to make it. At the same time, a lot of the residents here also face, they have a lack of digital resources, which then further leads to disconnection from the wider community. So what we've noticed is that there's more of a hyper local set of rules and social norms of what seem to be acceptable, which may not be acceptable in other communities. And they also live in unsafe and neglected and unsanitary living conditions. And I think this feeds into the same narrative that Rodri was talking about, where they already know that this is how they're seen and this is how the wider community sees them. So it leads to a lack of pride in the residents. So that wouldn't push them to, say, maintain the upkeep of the flats or make any changes in terms of like how it's neglected or unsanitary. And at the same time, the wider community also lacks respect for this particular community. So that leads to fly tipping, vandalizing, which just further adds into the cycle of making it unsanitary and neglected. And in terms of lack of security, we've heard stories about how there's a lot of different cases of destruction. Like Rodri said, there's bringing in of substances and a high rate of crime. And because all of this is happening in the community, services are left in a state of firefighting. And we know that services are already within a system that's had to prioritize working with crisis instead of working with prevention. And they're facing a lack of resources and they're increasingly burnt out and helpless. But because this has happened and because there's a lot of lack of funding, there's been a lot of restructuring within individual services as well that's led to people pulling out. And this has led to lack of trust in services from the residents who felt like they've been abandoned. Next slide, please. Thanks, Shan. Oh, I think there's one before this. Sorry. But we also looked at the strengths and skills within the community and what we can build on. And the residents shared that they are very resourceful and reflective. They're reflective of their own situations, but not just their own, of also other people living within the community. And this has led to improved compassions. And they've also been really resourceful because they've managed to survive in such poor conditions. We've noted that a lot of residents have different skills, and this builds on ABCD that Rodri was touching on. And residents have shared that there are some people who are mechanics and some people who are in building or construction. And it's not just from previous employment. There's also people with different skills. Like there's one person who's like the DIY guy. So if you break something at home, he's the person that you would take it to. There's someone else who has a catering degree, so he's the person who's seen like as the chef. So if someone's sick, he's the one who'll make meals for them. There's ex-veterans, so there's loads of different strengths within the community, and they also have a really good relationship with local provisions. For example, there's local cafe and there's a community center that's about 5 minutes from where this community lives, and that's the closest resources for them. So they have really good relationships with them, which creates opportunities to then support and access these resources, like the food bank that's available from the local cafe. There's also different roles within the community. So we've heard of one person being in charge of clearing the gardens, someone else who's seen as the key holder, one person who's the father figure, who also happens to be the person with the catering degree, someone else who's an alarm clock. So there's real examples of how these residents have been positively impacting each other. And they also take initiative to support each other. So there's someone who's been trained on how to counter drug overdose. which unfortunately is something that's seen quite frequently within the community. And they also take turns helping each other with the food collections. So if someone has mobility issues or if someone's sick, another person would volunteer to go pick up the food or go to the food bank for them. Another strength that we've noticed is that there's a real diversity in needs, and not just needs, even with skills and background. And I feel like this has been often overlooked because when people are talking about the narrative, they tend to focus on one particular demographic, but this isn't a true representation of the community. Next slide, please. Thank you. So we are going to look at the research and action and how we went about doing the work with the community. So I just wanted to touch on the adverse community experiences and resilience framework. This is from the Prevention Institute, and it's a really good piece of work. So I would highly recommend for you to go and read it. But basically, it looks at how you can address and prevent community trauma. And I think understanding trauma on a community level is really important because it manifests as symptoms both within individuals and across communities, like how you see how people living in this community is really disconnected and how they have disconnected social relations and networks as well. And what's often missed is that community trauma ends up multiplying the individual trauma as well. So if you look at this Venn diagram with the three different spheres, it looks at three different areas: that's equitable opportunity, people, and place. And they've used this to explain the different symptoms of community trauma. So I'll just pick out some of the symptoms that we've mentioned here, which includes long-term unemployment and disinvestment under equitable opportunity. Under place, they're talking about how there's deteriorated environments and unhealthy, often dangerous public spaces. And under people, they talk about how there's disconnected, damaged social relations. And I think you can then see how this relates to the stories that the communities have shared with us. And it just shows how the community, like there's real symptoms of community trauma here. So our goal was to support community healing and build resilience to then foster communities that can thrive, even in situations where they're facing this level of adversity. So even if they do face this level of adversity in the future. And how we've gone about it is through formulation. So we've got an accurate representation from the community themselves. So instead of telling them what the issues are, we've been truly community led. So all the stories that you've heard in the last two slides, that's come from the community themselves. And we also have a focus on context. So like Rodri said, it's about what's happened to you instead of what's wrong with you. And we have a holistic understanding where we're looking at the systems as well. Now, in terms of implementation for our project, the plan was to address these challenges, continually work in collaboration, both with the community as well as the systems around it, make sure that all the work that we're doing is sustainable because our project is to be till September 2026. So we need to make sure that everything's sustainable and it lasts even after we leave. And just to make sure that we prioritize ongoing evaluation, and this feeds into the human learning systems approach where we're constantly going into it, listening from the community, changing things if processes aren't working, and it's just a complete circle. Shan, thank you. Then we've looked at the community assessment of strengths and needs. Before I go into it, I will quickly say that with our project, it's been really broad in terms of the things that we've done with like intervention, evaluation, different methods. And I've had to pick certain things to go into just because of time constraints. But feel free to ask questions or I can answer them at the end. And I think Roddy and I both would be happy to share more on a later date if you want to share your emails with us. But with assessment of strengths and needs, what we've done is, again, based on all the theory and putting it into practice, the focus was on engagement, being formulation driven. That basically just means listening to the community, looking at the history, being co-produced and focusing on place-based and being community-led. So the first way that we did is obviously focusing on the residents that we're working with from the community. And how we've gone about it is by working with the speed of trust and just by seeing how the community itself connects with us. So how we did that is Rodri and I would show up regularly in the community through walkarounds with the council, doing food banks, being in the community cafe, and just being a familiar face. And also meeting with people where they're at. So when we would be in those spaces, we would have one-on-one conversations with the residents and genuinely just ask them, where are you from? your life been like, and what do you need? And all of this work also feeds into trauma-informed community building, which is another really interesting and helpful model if you're working with a community with this high level of trauma. But from speaking to the residents, we heard that a lot of them said that they needed ID cards and they need bank accounts. So that was the basic level of need that they had shared with us. So what we did was hold pop-ups where the main goal was to help them with ID cards and bank accounts. However, what happened was that we didn't have enough engagement, or everyone who shared that this was a need didn't end up showing up for this. And that's when we realized we had to dig deeper. We had to dig deeper, and there was a more basic level of need, which was food and connection. And now, because of that, we're holding regular breakfast mornings between two different locations. That's the cafe and the community center. And we've had about 12.5% of residents attend these on average. And what this does is it's increasing space of sanctuary for the residents. And at the same time, we've noticed there were loads of residents who didn't previously interact with each other, who were sitting down and having a meal together. So that was a really nice thing to see. And like I said, we can't just work with the residents, even though we're supporting the community. The community also includes the wider systems and stakeholders that work with them. So our next focus was on the stakeholders. And what we did was map out the local assets and services. Like I said, I was taken aback when I first started in September, and I just saw how many services, provisions, activities were being held in the wider area. So the first thing that we did was map these out and start building relationships with them. We also worked alongside the local assets. For example, how we do the breakfast mornings, that's done in collaboration with the two different centers and cafes. And we also promote this way of working in a trauma-informed way, and we do this both through actions and also by having one-on-one conversations with the directors and founders. Could you move to the next slide, please? Thank you. Oh, no, not this one. Thanks. So from what we've said about there being loads, this is just something that we've noticed is really helpful, and I would highly recommend if you also work within local communities. It's basically systemic mapping, or it's called a community genogram. And I've put this example in. This is from the start of a project, so maybe over a year ago. Right now, community map looks very different. We have about 80 residents and services mapped out on it, but I thought this might be easier to convey the message. But basically, you can see the one with the flat symbol. That's a community that we're working with. And then you can see the residents are mapped out around it. The one that looks like a coffee cup, that's a local cafe, and it shows who the people who volunteer are and who the boss is working there. And this is just really helpful because one, we can track our connections, but at the same time, see the relationships between different people in the community. So the main goal is to map relations between the community and the stakeholders, and also to see what kind and strength the relationship has. So if I take the dotted line that goes from the house to one member, the person Sam, that's meant to denote a distant relationship. So if we think actually if Sam had a better relationship with the community, that would be more helpful for maybe both Sam and the community. We can then focus on improving that relationship. So that's what systemic mapping or a community genogram is. Thank you. Our project also has a participatory action budget. So that's because our project's been funded by the Moon Dance Foundation, and it includes a participatory budget, which has been mobilized through the reactive and proactive fund pathways based on what the community shared. Basically, it's like now money and then sustainable money. That's what it is. And under the reactive fund pathway, we've mobilized that in different ways, which includes the well-being fund, pop-ups, breakfast that I mentioned, and resident circles. With the well-being fund, it's essentially a fund that's on average up to £60 that the residents can access for anything that can improve their well-being. So it's quite broad, and they can come and access it directly by working with me and Rodri, and we're available in the community. But the idea is that we would first look if they can access that money from somewhere else, for example, the DAF fund for white goods. And if it's something that another fund doesn't exist, that's when we would support them with that. And what's been used for this is, for example, a lot of residents have access this to get mobile phones. And that's when we notice that there's a real need or there's a real lack of digital resources within the community. The pop-ups include different things. So the picture there on the top is from a oral hygiene, health and hygiene pop-up from the health board. And that's again because the residents shared that this was a need. And the picture below, that's from when Rodri and I started. So that's why it looks very Christmassy. It's from last December. But that was the first pop-up that I mentioned where we were planning on helping residents with ID cards and bank account support. So we got some refreshments and we were just open to the residents coming and speaking to us. Breakfast, I already mentioned. And the resident circles are meant to be more like a semi-informal meeting group with the residents. And it's supposed to be a regular sense-making session to allow the community to be seen and heard. And the whole point of the reactive fund pathway is to make sure that we can increase access to basic needs and to give capacity to residents. Now, what we did was the data from this well-being fund and resident insight meetings and pop-up then informed how we created sustainable long-term change. And that's where the proactive fund comes into. And this feeds into sustainable projects and outcomes. And I will say the ACEs framework and the Venn diagram that I mentioned that talks about place, equitable opportunities, and people. What we made sure we did was look at how each project fits into those three different things. And I will come back to that um, in one of the following slides, but I just wanted to mention that's where this comes from. Say, for example, access to digital resources would feed under access to increasing opportunities for equitable opportunities in the community. And again, this like we decided to go and increase access to digital resources because we heard from the community that there was a real need, and a lot of people didn't have phones or didn't have laptops, which then led to further disconnection. So what we've done is we are creating shared hubs for digital resources. So we're getting some laptops for the local cafe and the local community center. And this is being done in collaboration with them. So that's how it's going to be sustainable. And our storytelling and illustrations project also feeds into the proactive fund pathway, and I will speak about it in the next slide. Oh, okay. So this is a quote from another resident. They said, "Living here has been very stressful. I don't like letting other people know where I live because they'll judge me." So this just feeds into what Rodri shared and how the residents have shared with us how they don't have much agency or choice in where they get to live, where they get to live. And they also have shared stories saying they feel really ashamed about saying where they're from. So the whole point of challenging the narrative is because that's something that the residents have shared that would be helpful. And it's just trying to acknowledge this and also challenging the narrative within the wider community. And how we've gone about it is through the storytelling and narrative approach, which is a way to increase sense making, agency, and voice within the community. And I think in one of the previous strengths based sessions, all was talking about how there's a real need for moving away from looking at data just in terms of numbers. Obviously, that's really helpful. For example, when I shared the percentage and how many people attended the breakfast, it's really important in different ways. But when we're talking about people and their lives and what they're going through, that's something that's a reality for them. Something like doing storytelling sessions would be much more helpful. So it just allows residents to speak their truth and share their stories. So it's helpful for them, but at the same time, if they're happy for us to share their stories with the wider community, that would foster emotional connection, build understanding, and inspire action. And this is so random, but I came across a quote yesterday and I just thought it fully encaptures what we're trying to do with the storytelling project. So I'm going to read it off my phone. And it says, "They aren't just stories, they're training grounds for imagination, for slipping into someone else's life, someone else's grief, joy, fear, or mess. They teach you to sit with feelings that aren't yours. Without that, how do you learn to care about people who aren't like you? How do you build a world where you pause before judging, listen before reacting, understand before dismissing?" And that's what we're trying to do through the storytelling project. And this is also the idea behind the illustrations project that we're currently working on. This example that we put here, that's not what we've done. This is just an example from the artist that we're working on, who is called Helen Frost. And the idea is that we're trying to use different mediums to support the community stories to be heard by decision makers. So I'm guessing like there's different kinds of benefits that come just from visualizing stories. It allows people to understand the concept, understand the context, and connect with people, see different perspectives, build empathy. And the plan would be to like that it would be used as a powerful bridge between the current scenario that the community is facing and the hope for the future. So we're hoping on having an illustration like this for September, and the plan is to hold an end of year event, invite important decision makers, stakeholders, and the residents themselves. And hopefully, this would encourage and drive some change. Shan. Thank you. Going on to evaluation. I just wanted to touch on ripple effects mapping. Like I said earlier, there's so many different ways that we've evaluated the project, but I'm just picking on some that I feel like would be most helpful to share here. But ripple effects mapping is one of them. So it's an evaluation method that's used to understand broad and unexpected impact of community projects. And I'll give you an example. If you're doing traditional evaluation and say, for example, you mapped out actions, I might say that we held a webinar and important stakeholders um, learned how to use this theory into practice. Like that's the only thing that we would map out from, say, this webinar. But what we might miss out on is, say, we held a webinar and shared it with important stakeholders. This one particular stakeholder ended up going and working in a community with a new understanding and a new level of compassion, and that had a ripple effect on the people that they're supporting. So it's just a really visual and nice way for you to map out like really small unintended, not small as small in that sense, it's like really big changes, but it's just recognizing unintended consequences and things that could just go unnoticed. And this has been really helpful for our team as well, because those are the smaller wins that you tend to not focus on, and I feel like that those tiny wins actually feed into the wider goal as well. And then going back to storytelling, what I mentioned in the previous slide. And I think the easiest way to mention or explain this is to say that they're like interview like sessions with the residents, but they're not interviews at all. It just shares like a nuance that other kinds of data doesn't show. And that shows the difference between what Rodri mentioned in the start, looking at clinical psychology and counseling psychology. We're looking at the person as a whole and also mapping out the different stories between them. So we'll see what the themes are between them, and this just adds to increasing sense of belonging, validation, and it's a fully relational process. So unlike a traditional interview where you might go have a list of questions and just facilitate that, this is quite different. Like the residents can get involved in different things like where you meet, how long the sessions are for, and how many sessions they'll be a part of. So this is a really good way in which you can evaluate your project as well. Another way is through feedback. So the quote at the bottom is from one of the residents that we support. They've said, I don't feel comfortable with a lot of people. I never open up like this. Knew you were genuine when we met, felt non judgmental and like a normal conversation. Thank you so much for helping me get back on track. So that's really nice to hear. And while it is really nice to hear positive feedback like that, we also know that it might be really difficult for residents to share anything that might not be as positive, or maybe if they want to see some kind of change. So what we've done is we've utilized cards. And I know Julie Ree's pathway, she's on this meeting. We've actually adapted this from their feedback cards that they use in their project and service. The front of it basically just says platform in the name of a project, and this is the back of it, which asks questions about how they're feeling, what they like to see more of, and feedback from the day. This has been filled out by a resident who's come for one of the breakfast mornings a couple weeks ago. So they've said, feeling good after a full breakfast. They want to see more clean sheds and gardens out back, and it's nice to see everyone for breakfast. So this is really helpful feedback because we get to see what they actually want to see more of. And this then feeds into our sustainable outcomes, and that's how we're working in accordance to the human learning systems. Oh, this is my favorite slide. It's talking about the challenges in working in a strengths-based way. I think there's strength in solidarity, and I think there's also strength in recognizing what's actually been difficult and the realities of working in communities. Obviously, we've mentioned the theory, and it's really helpful to have that backing us, but it's still really difficult to work in this way. And the first thing that I want to touch on is how the current systems and their impact on services. Systems right now have been set up to then firefight, which leaves the services at full capacity while they're already under-resourced, and they're leading with funding cuts. And what we've noticed is that when there's already smaller teams within different services, and if there's two different teams who are working towards the same outcomes, for some reason, the way the systems have been set up, it's done in a way that it's created an atmosphere of competition. So instead of working together, it's almost like the incentive is to work against each other, which is really unfortunate. And we've heard from people working in services that they're not given places to be reflective as well. say for example, even though Rodri and I's job, it's really difficult. We have different things set up in a cross platform where we have spaces to reflect on our work, see what's working, what's not working, and get advice on how we can move away from that or do things differently. Whereas I've met different people working in services who have said that they just don't have those spaces and they're just doing one thing after the other, moving through different tasks and just ticking things off a list. So that's been really difficult. And even though we've talked about how the community itself doesn't have access to services, or they have they have a lack of digital resources, we understand that it's not fully on people working in the different services as well, because that's the kind of systems that they're working in, which is why it's really important for us to share this message with decision makers as well. The second bit that's been really difficult is just the realities of working in a community setting. There's a lot of really strong dynamics and relationships within communities, and it takes a lot of time to build trust, especially being outsiders, because Rodri and I aren't people who live within that particular community. It's been really hard. And just add on top of that how a lot of the projects are funded for a very short period. That's not enough time. Like, we keep talking about how it would be really nice if we had an entire year just to build engagement and build relationships, but that's not the reality. And it's also been really hard to share trauma informed ways of working and to share its merits. It's just that things take time to change and people don't necessarily like change. So that's been really difficult. Adding to all of that is our team. We have a really small team. Rodri and I work full time. So it's two of us working full time on the ground. And obviously, we also have our clinical psychologist, Dr. Joy Jeffries, who's joined us. Um, she's also there, but it is still a really small team. So there's a lot of periods of uncertainty. Our jobs are ever changing. For example, we started with the one-on-one work to then build on engagement, build relationships, and now we're doing more like wider skill work. But then again, because we are focusing on human learning systems and being community led, things are changing. I feel like our jobs are changing every 3 months. And that is difficult and really hard to get used to, because you feel like you're getting into the groove of something and then that just quickly changes. And I feel like I've heard that it's a similar way with other community development projects as well. And there's also real risk within working in this community, like I shared. While there are strengths and skills within the community, the reality is that there are lots of people who have a lot of traumatic histories and are from forensic backgrounds. And just the way the systems have been set up for them as well, there's a really high level of crime there. It's also been really difficult for us to set realistic expectations. Knowing the theory and then seeing the skills, strengths, and just how proactive the community's been, it's really hard for us to just set realistic expectations because we can see what we can do with the community. So working with that and a realistic timeline has been really difficult, and that's what this little diagram shows. We keep thinking there's like A, and then this is how you get to B. That's our expectation, but it's often been A and a bunch of squiggly lines before you get to B. And this has just been what we've noticed have been challenges in working in a strengths-based way. But if any of you think you relate to this, or if you have any advice for us, feel free to let us know in the chat. Where do we go from here? Since I mentioned the difficulties that services themselves face, what we're facing, and what we're seeing from the community, what's been most important is to make sure we model collaborative ways of working. Like I said, there's loads out there. So we need to be working together to build capacity. And how we've done that with an example is Rodri and I recently got an award for this from the council, where we met a resident, not just by themselves, we met them with every other professional that supports them. Because what we've noticed is that we'll go support them and they'll say, oh, they have this support worker from the drug and alcohol service, and then they have another person from the health board. It's really disconnected. And then we're asking this resident who's already going through a lot to then be the point of contact. So that's just making their lives even more difficult. So by collaborating, it's making our jobs easier and making their lives easier. So it's actually a win-win situation for everyone. And I think now more than ever, there's a need for services to collaborate, build capacity. It becomes time efficient, especially when we're all really busy and under resourced. Another way that we've done it is Rodri's created an easily accessible think tank. So it's basically a Teams chat with stakeholders where if someone from the GP needs to find out who's in charge of, say, tenancy support services, and they just have a quick question on it, which would help them with the person that they're supporting, they can just pop a question on the team chat, and if someone else is available, they can answer that question. And another way that we've gone from here in terms of our work itself is just by being really honest, transparent, listening to the community, and being fully community led, and also constantly reevaluating and having compassion for community and services. So these are some of the quotes that we've got from the residents. So this is resident saying that, thank you for the help. Before you do, it felt like I was taking one step forward and two steps back. This is a quote from one of the local cafe directors. They said, it'll be nice to see the community spirit back instead of what we see everywhere now. What you've done is amazing. Thank you. Since you two have been here, feels like things have been moving forward. And the next quote is from the antisocial behavior officer who works really closely with the community. They've said, thanks, everyone. Nice to see a positive outcome for a change. Teamwork makes the dream work. So it's just quotes showing that actually working in collaborative ways of working and working with the theory that we're working with and just in this way works. I feel like I said work a bunch of times. Shan? So then all of that comes back to what I mentioned, the ACEs framework, the three different spheres within the Venn diagram, and that's what we use to support our sustainable outcomes and building connections within the community. And how we've done this is, I'll just pick some examples from each of these, and this is just what we've been doing and what we're doing for the next 3 months and what we'll hopefully be able to do within the next year till next September as well. So say under place, practical actions that we're taking and a project that we're working on looks at, say, making the physical environment safer. So for this, we're collaborating with the local council. Another thing under place is, say, crime reduction. And for this, we're collaborating with the police. So these are initiatives that are then taken forward by different organizations that are based there. So how we're building capacity is by we can provide the support and scaffold these projects, and then it can be taken forward by these different organizations that are based within the community. And say for people, what comes under that is the resident circles that I mentioned, which is the sense making circles. We're hoping that this would lead to sustainable leaders and it would have ripple effects on others within the community where they can take psychological knowledge and put it into practice. And we're hoping this would also have positive effect on their interpersonal relationships as well, and with confidence building and to help them advocate for themselves in the future. And under equitable opportunities, what we're doing is what I mentioned, access to digital resources, which is then monitored and managed by the local community center, and also improving access to healthcare. So right now, we're working with the local GP surgeries and pharmacies to improve that. Now, apart from these three different areas and the sustainable projects, another thing that Rodri and I are offering are also trauma-informed training and reflective practice. So like I mentioned, a lot of people have said that they don't have the spaces to reflect on their work. So this would just be a way to then build capacity in systems to help think and reflect and take that skill set forward. And this is the most important bit. And what we're doing right now is sharing our work. While all the work that we're doing is really important, we think it's also important to make sure that we're working on dissemination, to share our learnings and to inspire and support other people to do that. So the goal is to encourage this way of working and to help other people take these initiatives forward. And like Rodri mentioned in the start, like this is not something that we're experts in. This is my first assistant psychologist role, and I've never worked in this way before. But it's just been a learning process and just having compassion for yourself, having compassion for the community, and realizing that it's okay to mess up as long as you're backed by that theory, as long as you keep the community at the center and make sure that they're the experts and you're being led by them, you'll be doing fine. Shan? Oh, that's it from us. This is just a nice picture showing like community spirit, but that's it from Rodri and I, and hope this has been helpful. But I would be happy to answer any questions, or if you have any suggestions in working in a strengths-based way, we would be really keen on listening to more.
Thank you both so much. That was brilliant. It's always really lovely to hear about the work that you're doing. It's a brilliant project and it has a brilliant team working on it. We will take some questions. I'm gonna say let's take a 5-minute break, just to go grab a drink, use the toilet, do whatever you need to do. We'll come back at 11 and then there'll be space for questions, and I will just wrap up by sharing a little bit more about some of the other stuff that Platform is doing. There are huge thanks coming in the chat, so Well done both, and thank you very much. I'm going to stop the recording. So, oh, that's my screen sharing. Sorry. I'm going to stop the recording. If everyone wants to take a break, come back in 5 and we'll see you at 11 for some questions.